Hey guys, and welcome to another episode of EMG's Talk About. I'm Damien Navarro, one of EMG's managing partners, and I am here to start a little discussion about some hot topics of today. So I have decided to invite some of my, not notorious, that's probably bad, but some of my esteemed colleagues to discuss some of the happenings this week. I think one of the most interesting to me was that Google Health announced that they are going to be shutting their doors. And Amanda and I were talking a little earlier. I thought something that was really interesting is that it's not costing them anything really to keep these kind of doors open. So what is it? And and that kind of got me thinking a little bit more around other, I don't know what you categorize them as, data management kind of portals or softwares, because people are very interested in tracking everything. And we saw this a lot originally in almost the gaming industry, where you can track points and it can become social and can be community based. And we've seen that now cross over into things in the travel industry, fashion, but healthcare. I thought was really interesting about that type of canary going under, right? What does that mean? What is that showing for the rest of the industry when it comes to managing something as personal as your health? And then I also had noticed that another big company that had kind of got some buzz around it in the recent time, Power Meter, which again was just another way of people's ability to track their energy consumption. So I guess the topic is what's happening. One of the things that of course popped into mind immediately is, was it too soon? We talk a lot about that at EMG, this build it and they will come attitude. Were they too far ahead of the curve with either of these? So what do you guys think? I mean, is it just too soon? I mean, is this something that we will see in the future? Or is it something that maybe there are just areas of personal data that people just aren't interested in tracking in this type of way or environment?
Yeah, I mean, I would say it has a lot to do with the data that you're sharing and saving. And Google Health, I mean, it was launched pretty quickly, so there's likely a lot of risk, that they took on without maybe fully understanding it. I don't know if that's true. Google's pretty thoughtful whenever they're putting something out. But the question I still have is, number one, what are they going to do with that data that they have? Mm-hmm. Clearly, you can, download it for yourself and transfer it somewhere else. But, what are they going to do with that? What is their responsibility, and what is their actual legal accountability? I haven't looked into this. But then also, what's their measure of adoption success? I mean, why couldn't this small group of people that are using it be enough to substantiate continuing it? So right. I think people's understanding of adoption maybe needs to shift. Maybe it is a niche group of people that are going to use it, and that is success. Right. So I think Google rethinking that, and maybe they're just saying it's an adoption issue too. Maybe they just saw too much risk in continuing it and are calling it off. Right. So, I'm trying to question behind the question.
Well, and I know that also Google, for example, is stuck in this antitrust predicament right now, where the federal government is looking very closely at them. So maybe, I guess we can all come up with conspiracy theories, but there's definitely something beyond simply the adoption that I feel is beyond this.
Yeah. Well, every company has its own standards for, is it worth us to continue developing it? Maybe kind of like Google's own idea for scaling something. Maybe just for them, it just didn't. I don't know what type of internal thresholds. But I think what's difficult with something like you take Power Meter is you're not just talking about consumer adoption. You have to talk about the adoption of device manufacturers. So every single device that was going to be compliant with Google Power Meter had to have a built-in, I believe, a server on board to communicate back with Google. So you're asking the companies to add in a lot of costs there. So why do I want to pay more for this lamp because it's has this server? I'd rather just buy the normal lamp. So I think you have to get multiple parties on board.
It's not just simply an individual.
It's not just consumers. You're asking device manufacturers to build into that system. So I think that's certainly working against them, and not to mention power companies and meters. That's a beyond just maintaining the code. There's also the partnership development, which I imagine is a lot of energy, and I think that probably had something to do with it as well.
Right.
Well, going back to the consumer side for Google Health, I think one of the problems with adoption, if you look at it from a pure benefits and value standpoint, is that the consumer really didn't understand how it would benefit them. There's a great article in TechCrunch that came out today, and one of the points that they made was it didn't fit within the healthcare model or the insurance model. So the way that works is, if you're on HMO or PPO, there's certain information that works within that system that they all have to use because it's a network. So what that essentially became was a file cabinet of information that users didn't really know how it would benefit them. So I think the data could have been stored and utilized if the user understood how that can help them manage their health a little bit better. But if it was used for sharing it amongst healthcare providers, it's not something that would have been adopted within the system anyways. So I think, device and consumer value, and then also understanding where it fits in the industry. It probably didn't have industry adoption.
Right.
Yeah.
So I think they had a lot of things working against them. And it was a good effort forward, but I don't know if they actually kind of really thought about it that far.
So I want to kind of interject for something. So you said something. You said the word file cabinet, right? There's nothing sexy about a file cabinet. No, seriously, think about this, right? If that's what you're selling me,
right?
What do a file cabinet with my health records in it? There's nothing sexy about it. Now you talked about what does it do for me? Well, okay, that's sexy, right? Do I save money, right? Do I live longer? I don't really think that was part of what was being sold. I was being sold a file cabinet. That's not sexy. Now you look at some of the programs out there like Fitbit or Zeo, right? Fitbit, I'm going to lose weight. Zeo, I'm going to sleep better. You have like Runkeep or different apps that, that to me, you can sell me that all day.
Okay, so now to switch gears a little bit, let's talk about who's done it right. I mean, I know one of the ones that I use on a daily basis is TripIt, and it's been incredible. And the fact that it can connect to so many other storage areas, and you talked a lot about a file cabinet. It would be like a smart file cabinet that can connect to 20 other file cabinets in many different areas. And especially with managing profiles for so many rewards and loyalty programs that are out there, that I tend to use more than anything. So that's a really exciting thing that I'm not familiar with how TripIt's doing. I'd like to think it's growing. I know its business integration has been pretty considerable. But what about you guys? Do you know of any that you think is getting it right? Or that you guys use on a daily basis?
Yeah, well, when you talk about personal data management?
Personal data management, absolutely. Or what do you think might be the future? Where can you see, whether it's in healthcare or whether it's in energy consumption? When do you see it coming back? What is the tipping point? What would you personally use? I think it's just making this a little bit more personal to, is there any particular stories?
Well, I think Google actually will do it right. They announced recently at their I/O conference some initiatives around Google at Home. They've been tremendously successful selling you the idea of an Android device. I mean, the device is actually made by someone else, but it's an Android device, right? So I think you're going to actually see them take what they've learned with Android and apply it to lamps. Whereas before, no one really knew about Power Meter. It's kind of generic sounding. You're going to see Android at Home, and I think that's going to that's where they're going to succeed.
So you're anticipating technology to be a huge driver on the level of integration now with them having their own portable personal device. Taking this to another level of their connectivity and adoption. Yeah,
and that data is fed back to me. So if it's running on like a lamp or a refrigerator or microwave running on Android at home or any type of device, that way it can feed back to my central device management, which is my phone, or and so I think that's I can see that happening.
What about you guys?
Well, what I've seen successful, just anecdotally, have been the weight loss management tools like Livestrong, and have known at least 3 people who've lost 20 pounds or more just by keeping track of what they were eating and looking at the information, and swear by the mobile application that they were using. So I think when it relates to health, anything that can help you better manage your health will probably be successful. So going back to the Google Health example, let's say it was truly just a file cabinet, but had they maybe positioned it in a way that was, you have one central information for your data that you can use anywhere. Your information is fragmented amongst the healthcare system. Use this as a tool to help educate yourselves when you go visit your doctors. That might have been a better sell. In addition, when it relates to healthcare, I think clinicians and healthcare providers actually need those tools when they're seeing their patients. It's going to help them be more efficient. So I think that we're going to probably see more of the e-health types of applications that will grow in the healthcare industry.
Yeah, for physicians themselves.
Yeah.
I think it's critical.
And as a final takeaway, does anybody use any type of other personal data management?
I use for finances. So that's, I think, that is related also to like weight loss, or when you're managing sort of input output. You know, it could be, you know, through what, like your.
Well, you just mentioned something too. It's very quantitative.
Yeah.
You know, a lot of the
Yeah,
ones that
that's
my
true.
TripIt is point driven. You know,
Yeah.
healthcare tends to be a little bit more open ended. It's
Yeah.
not as data driven. If I put all this stuff, if I upload videos, so we're getting something. Kind of what you're talking about. The connection to what we're getting is much more visual and apparent. Very cool.
Actually, I got a crazy question for y'all that I've been thinking about, if you don't mind. I'm moderating this, but as we were, you know, dependent on our devices to kind of regulate our lives, right? So we, you know, we don't memorize phone numbers anymore. It's in our
Right.
device. We don't navigate anymore because we have Google Maps, right?
Right.
And I found myself on streets just staring at like
Yeah.
Google Maps, and there's like something across this, like it's right
course.
there, right?
Sign, yeah.
So what happens when we rely increasingly? We outsource like. You know how our diet or how we're eating to our phones. Like our phones help us optimize our diet. Do we lose the ability to internally regulate like healthy eating? Like I won't work out without my phone, which tracks my run, right?
Right.
Do we continually outsource these key functions that we use to regulate ourselves? You know, do you see that?
I think you can argue that we're not doing a good job with those sorts of things. So let's have whatever tools we have at our disposal, you know, to help us with that.
You're
But,
saying we're not doing a good job. Let someone else come on board.
I mean, when it comes to finance,
We've had
when
our
it comes
chance.
to wellness, when it comes to diet, I mean, those sorts of things, for sure. I mean, if you know, I think we do need all the support we can get.
But I also look at the bell curve. I mean, there's gonna be an equilibrium that's striked at some point. I mean, there's always going to be really high adoption, and then we understand that I've done this. You know, whether it's Foursquare, whether it's LinkedIn. You know, at first you want to combine all that data,
Right.
and then you use it really passionately, and you're following it every time, and then it finds a balance at some point.
Yeah.
I think that's what we're going to see over. It's the long-term user adoption, and I absolutely agree with you. Like as a closing, that I think mobile is going to be the major paradigm shift for the high adoption and connectivity, and Wi-Fi and wireless. I mean, that's really where these smart devices will truly be that, just smart. So, well, thank you guys so much, and just remember, you can find much more talk abouts all in our Knowledge Center as well as on our YouTube page. Have a great week.